I am Dr. Sasikala, Reader, Department of Oral Maxillofacial Surgery, SRM Medical College and Hospital, Ramapuram. I am going to talk on intraarticular injection of autologous conditioned serum for the management of temporomandibular joint disorders. TMJ osteoarthritis is a frequently encountered condition characterized by the gradual degradation of both hard and soft tissues within the joint. This degeneration develops over time and is often linked to factors such as mechanical strain, injuries, disc disorders, and systemic illnesses like rheumatoid arthritis. Inflammatory changes commonly accompany the degenerative process in the TMJ associated with osteoarthritis. The clinical manifestations of osteoarthritis typically involve symptoms like pain-restricted jaw movement and the presence of crepitus during mouth opening. These symptoms often indicate underlying changes within the joint structures. In osteoarthritis, these changes manifest as alteration in the joint surface, characterized by erosion, sclerosis, thinning, and the formation of osteophytes, which may be observed unilaterally or bilaterally in the TMJs. Additionally, alteration in the composition of synovial fluid accompany these structural changes, often characterized by the elevated levels of inflammatory mediators such as interleukin-1 beta, tumor necrosing factor alpha, and interleukin-6. The balance of the cytokines along with the receptors and receptor antagonists are crucial not just for the initiation and progression of osteoarthritis but also in the clinical expression of this condition. Therefore, cytokines have been proposed as targets in the therapy of osteoarthritis. Interleukin-1 beta, a pro-inflammatory cytokine, seems to play an important role in the production of collagenase and prostaglandins by releasing a cascade of inflammatory and catabolic events, resulting in the reduction in the synthesis of proteoglycans and cartilage-specific collagens. TMJ osteoarthritis management typically involves conservative, minimally invasive or surgical approaches. Initially, conservative methods are preferred for 90 to 95% of cases, but their efficacy diminishes in severe chronic conditions. Open surgical procedures are required in only 5 to 10% of patients with TMJ disorders. Minimally invasive options such as arthrocentesis and arthroscopy, along with injectable solutions containing anti-inflammatory and regenerative properties, bridge the gap between conservative and surgical approaches. These interventions deliver targeted treatment directly to the affected area, promoting healing. Autologous conditioned serum, derived from patients' own blood, has its origin in the mid-1990s when it was formulated as an injectable solution. Clinical research conducted on knee osteoarthritis has demonstrated that ACS has the capacity to mitigate the degenerative effects of inflammatory substances while facilitating tissue regeneration through the stimulation of growth factors. The ability of the ACS to suppress the cytokine interleukin-1 beta, specifically through the generation of its natural receptor antagonist, interleukin-1 receptor antagonist, has positioned ACS a highly esteemed option for managing degenerative joint diseases. A patient reported to SRM Medical College and Hospital with a complaint of pain in both her right and left facial joints for past 7 years. The patient reports a dull and persistent pain in her joints, more on the right side, which extends to her neck, shoulders, and right hand. She experiences severe discomfort in the right joint, making eating, talking, and opening her mouth wide difficult. Additionally, in her left joint, she describes a crushing or grinding sensation. She also complains of ear blockage, headache, and tinnitus. Furthermore, she has been experiencing sleep disturbances for past 4 years. 10 years ago, the patient underwent an extraction procedure. Additionally, 7 years ago, she received occlusal splint therapy, which was only continued for 3 months due to worsening pain. Subsequently, she discontinued treatment due to the severe discomfort she experienced. The patient reports a pain level of 6 and 4 on the right and left joint respectively on the visual unlock scale. Jaw locking has occurred infrequently in the past and clicking sounds are present in right side, crepitus on the left side. Tenderness is noted in both TMJs and in the masseter and temporalis muscles. Bilateral TMJ pain occurs during lateral excursion and protrusive movement. Mouth opening measures 42 mm with pain and 24 mm without pain with no observed deflection or deviation. Degenerative changes were observed on both the condyles on the panoramic radiograph. The CT scan revealed degenerative alterations and the presence of osteophytes. MRI indicated anterior disc displacement with partial reduction on right side. The left side, there was a disc displacement without reduction with central perforation. To prepare autologous conditioned serum, a process was followed. Initially, 10 ml of blood was drawn from a vein in the upper arm of the patient using a cannula and transferred into a blood collection tube. The filled tube was gently swilled 3 to 4 times and then allowed to incubate for 3 hours at 37 degrees centigrade. After the incubation period, the blood was centrifuged at 4000 rpm for 5 minutes. Using a 5 ml Luverlock syringe, a serum supernatant was carefully separated. Approximately 3 to 5 ml of serum was obtained from the processed autologous blood. Finally, 3 ml of serum was injected into 3 sites, with 1 ml administered into each site. The posterior joint space was located by observing a depression in front of and slightly below the tragus during mouth opening, with the needle directed in an anteromedial orientation to avoid ear penetration. Identification of the anterior disc attachment to the lateral pterygoid muscle involved locating a depression in front of the condyle during mouth closure. The third site is located at the most tender area in the masseter attachment along the lower border of the zygomatic arch. After a 2-hour follow-up, the patient reported the absence of pain in both the joints, a reduction in crepitus sound, and achieved good mouth opening without experiencing any pain. ACS has also been investigated in several animal studies. Histological evaluation 24 rabbits revealed the presence of fibrocartilage articular thickening of mandibular condyles following ACS injection therapy. In comparison with the rabbits treated with plain saline injections, the ACS group exhibited less degenerative change at 24 weeks. Previous studies in mice have shown the presence of growth factors including FGF2, HGF, and TGF beta 1 indicative of rapid regeneration. Autologous conditioned serum has been studied and used in various joints of the body for the treatment of certain musculoskeletal conditions. While ACS has been most commonly studied and used in the treatment of knee osteoarthritis, it has also been explored for use in other joints such as hip, shoulder, and ankle. In one such study, 15 patients with knee osteoarthritis symptoms received 4 weekly injections of autologous conditioned serum termed a disease-modifying osteoarthritic drug, which demonstrated beneficial effects including reduction of knee pain and enhancement of joint function. Additionally, ACS was found to be easily administered, safe, minimally invasive, less toxic, and well tolerated with few contraindications. ACS demonstrate notable efficacy as an intraarticular injectable for the management of TMJ osteoarthritis. It represents an ideal and minimally invasive alternative treatment, ultimately contributing to improved joint function integrity. Thank you.